We took a look at the apnea hypopnea index. We see if it's central or obstructed, and we take a look at the leg movements. Okay. So when we say apnea, there is no breathing for at least 10 seconds. If it's less than 10 seconds, we do not count it. When we say hypopnea, there's a decrease in the amount of air breathing for at least 10 seconds, but it is associated with a drop in the oxygen saturation. So this is an example of obstructive apnea in the lab. So this is the breathing. 32 seconds in duration. So the patient's breathing, stop breathing, opens breathing, no airflow. If you take a look at here, there's paradoxical movement of the dots. Napanaw yung oxygen, 57 and 57%. They drop to 57%. Okay, the effort blood levels less than 4%. So this is the 3-minute pace. If you take a look at the oxygen, it goes up and down, up and down. 77, 77, no? Maginawa lang, you breathe na sa. Hypopnea is like this, shallow breathing, okay? Dili siya complete absence, but there is a drop in your oxygen by 4%. And that's what we mean by hypopnea. Okay, so this is an example of hypopnea. So you see there's a decrease in airflow and there's a decrease in oxygen. Natanawa in snoring. Murag nga. That's what we see. Okay? Look at this oxygen saturation of this patient. When he's awake, his SATs are okay, but take a look at this. Ang SATs is down to 60%. Kung mata pa na naka-post-ox na wala, ipa-ICU na natin mo. Kaya natuog man, so natuog sa down, so wala sa tagabantay. But that's actually very dangerous. Okay? This brings a good example. If you take a look at the oxygen saturation, the saturations here are down than normal. Why is there intermittent desaturation? Because if you take a look at this patient is actually awake over here. Okay? And here's another episode where he's awake. So only when he sleeps does his oxygen saturation rise. So apnea hypopnea index is basically what we say. If it's 5 to 15, it's mild. More than 15, it's moderate. If it's more than 40, it's severe. Central is like this. There's no effort at all. The patient doesn't breathe. Okay? So this patient went for a sleep study, and what we found out that he had very poor sleep efficiency. His slow wave sleep, his restorative sleep was only 1%. REM sleep was 12%. Okay? His apnea hypopnea index was 52, severe. His longest apnea was 60.9 seconds. Sometimes we see 1.5 minutes of sleep log. They didn't know for 1.5 minutes. Okay? So average oxygen saturation 93.5%. Lowest oxygen saturation was 62%. Okay. How do you treat sleep apnea? These are the conservative options that you should probably do in all of your patients with sleep apnea. If you suspect that the patient has sleep apnea, definitely weight loss. 20% of weight loss can drop the sleep apnea by half, but that's a lot. If you think about it, a 200-pound gentleman should lose 40 pounds to get the obstructive sleep apnea. In most instances, if you can drop to a real body weight, the sleep apnea will become mild or even be cured. But it's easier said than done. Sleep on your side rather than your back. Patakili lang. May ubang na sleep apnea occur lang when they lie flat. But when you lie them lying this side, it disappears. No alcohol, no smoking, no sedatives. Morning, if you give somebody who's complaining that he cannot sleep, and you give them a sleeping tablet, niya masamot o katulgon, he may have obstructive sleep apnea. Kung may tabo mo na, you're actually suppressing his awakenings. So mas mabugay ang desaturation, mas tuyaw na. Elevate head of bed, and then going to bed exhausted increases risk. Okay? Sometimes it congests into it. If you want to have somebody sleep on your side, this is how you do it. You have a t-shirt, you put a small pocket at the back, you put 3 tennis balls, and you amin. So may tabuhan na, napakilid siya, na pag may bulag rin sakit na, napakilid siya diyan. Or what you can do is you can marry, you can get married and you can have your wife do sicko all the time. Okay, so mauna. So those are the options. Okay. So the only treatment that we have that's 100% effective is what we call CPAP, continuous positive airway pressure. So this is just like a CPAP, CPAP. It's positive pressure that's actually pushed into the airway to get the airway open. It's 100% effective when we can use it. So nasal CPAP, the treatment of choice, it's not as costly as surgery. Compliance though is a little bit poor. Kaya uban, hindi na magsulog sa ilong. No? Pero usually the severe and the moderate ones usually derives the most benefit from wearing the CPAP. And there's studies have shown that it improves long-term outcome compared to surgery. Okay. The only thing with CPAP is that it's like eyeglasses. Okay? Not everybody wears the same eyeglasses. Ngayon ka, libat mo kung palit lang mo ng tipara, musulod ko ng tipara, nasamot ka malibat. Same thing with CPAP. What happens is that we go to the sleep lab, we put them on the CPAP mask, and we start increasing the pressure till we see the obstructive apneas, the hypopneas disappear, the desaturations and the snoring disappear, and that's a prescription we give. And the prescription is basically the settings that's set on the machine of the patient when he wears it at night to treat this obstructive sleep apnea. So if you notice over here, this is how it works. So there's obstruction, air is pushed here, and the oxygen normalizes, breathing normalizes. The machines are getting smaller, unfortunately getting cheaper. Okay? Nanay Taiwan model